I am a longtime Southern California resident. I was born and raised here. I am a divorced father of two amazing boys, 16 and 20. I went originally to college at Sacramento State and got a communications degree, which entailed public speaking and writing, two of my favorite things to do. Go figure. And through that time, I was in the restaurant business, and I worked in the restaurant business from the time I was 15 all the way through past Sac State and beyond. I couldn't really find anything that I wanted to do after I graduated, so I just stuck with it. So I was a restaurant manager, waiter, I've done everything. And at the time I was living with my cousin. Previous to that, I was involved in a fairly minor car accident, so I had had some chiropractic care, which I got amazing results from. And so she kind of pointed me in that direction. And at the time, I was married, had a 2-year-old, and the idea of going back to school was not really a high priority on my part, but I decided to give it a shot. Went through about 6 years of school to get through chiropractic school, and then that's kind of how I came to the point where I'm at now. And I've graduated in '97, so I've been practicing about 15 years. Does everybody have the handouts? Everybody's got a copy of that? Okay. What I'm going to do is I'm going to kind of go over a little bit about what chiropractic is and what we actually do. Now, how many in the room have actually had chiropractic care? So a fair amount of you. Okay. Starting from the basics, the musculoskeletal system, where we're dealing with headaches, back pain, neck pain, those type of things. If you look at the first sheet here, what this basically is showing is the nerves that come off the spine that deal with the musculoskeletal type things. So when you look at the whole nervous system, everything has to start in the brain. And all impulses start from the brain and have to go down the spinal column and out. So if there's any interference in that spinal column, anything that those nerves go to is going to be affected. And it only takes a pressure of a dime to affect that nerve. So if you had pressure, now looking back to what Bick was talking about with carpal tunnel and how that relates to the neck, if you look at the base of the neck and follow these nerves down the shoulder, down into the hand, if you have that pressure of a dime on that nerve, you could have problems with your wrist. You don't necessarily have to have the radiation of pain that goes all the way down, but you could have those issues. As an example, I had a patient that came in a few years ago. She had low back pain, got great results over the course of a couple of weeks, went through a full consultation with her, an exam and all, and the low back pain went away. And she had mentioned at that time that, I've been having numbness in my toe, my big toe, that I've had for years. Didn't really think about mentioning it to you, but it has gone away. Now, there was no problem with her toe. It was the problems that she had with her low back because the pressure on the nerve was coming from the low back, if that makes sense. So what we do when we adjust you, we free up those nerves, get the joints moving so everything can flow the way it's supposed to. And the nerve is similar to a simplistic analogy as a garden hose. If you were to step on a garden hose, how much water comes out of the end? Not much. When you take that pressure off, you have a free flow. This is the same thing with the nerves coming off the spine. So that's what we're doing when we adjust you. Interesting thing, a lot of people are kind of freaked out about the sound, the popping. Michael, you like that sound. Does anybody know exactly what that is? Air, yeah. And basically what it is when you have two joints that come together, or two bones that come together to form a joint. And that joint, around that joint is a sac. Within the sac is fluid. Within the fluid is gas. So when you cavitate or separate that joint, that's the sound of the gas escaping. So when we adjust you and you hear that sound, that's all it is. It sounds very much like it's bone on bone type thing, but it's not really. And the interesting thing is I can move my thumb the same amount, there's no sound. And the reason for that is it takes 20 minutes for that gas to resorb back into the joint to where if you move that joint again, you hear the sound. So when we adjust you don't always have to necessarily hear the sound, although it's kind of a nice thing because it kind of feels like we're getting something done. The other, yeah, what's that? Visceral feedback. Yes. Now the next one is a picture that shows all the internal organs. Now why this is important is those nerves that come off the spine if you have the pressure on the nerves, it doesn't just go to the muscles, ligaments, skin sensations. It also goes to internal organs. So it can affect to what's going on internally. So if somebody has, as an example, mid-back pain, they can also have indigestion type problems. And further on down, you can look through all there and see where those nerves go to and what can be affected. I'm not saying that when we adjust you, if you have heart problems, it's going to take care of your heart problems. But if the whole nervous system is working the way it's supposed to, things are going to work the way that they're supposed to. As an example, I had another gal, she came in, her and her husband had been trying to get pregnant for years. They've gone through a lot of the testing and the in vitro and all that kind of stuff, and nothing was working. We adjusted her, and after a couple of weeks, I wouldn't say a couple of weeks, this was about 8 years ago. It was probably a month, a little over a month, she got pregnant. Her nervous system was working the way it's supposed to, so all those organs were starting to work the way that they're supposed to. Now, the last one, this kind of shows, this gives another indication of you can follow each individual nerve and find out exactly what is affected by that nerve. So you can look all the way down, and there's different areas that maybe you wouldn't even think that, okay, if I was having pressure in this area of the spine, these things could be helped. So you can look all the way down through there on what, like asthma. We help a lot with asthma. That's a big one. Digestive type things. Colds. Where's Quinn? Colds. Because they actually did tests when people, they took supplement or things that are in the blood, they checked the levels of those before and also after adjusting. And after adjusting, they were actually increased after we adjust the upper part of the neck. Because all the top two vertebrae in the bones, or vertebrae in the back, those control the immune system function. So that definitely helps with colds and flus and those type of things. There's one other one, just a little handout. We also deal with sports injuries, shoulders, knees, ankles, elbows, wrists, all those kind of things. And it helps really well. This kind of goes over some of the things that we can do, and on the inside it has a lot of stretches that you can do. You can kind of read that. I won't go over all those individually, but you can read through those and see which ones work the best for you if you're having tightness in the neck or shoulders or legs and those type of things. Now, to help me out referral-wise, I put on here my card. This is a referral card, and it's something that you can give out to anybody who might be complaining of, neck pain, headaches, those type of things. And on the back, it has an offer that you can come into the office, any needed x-rays, $17. It covers everything. There's no obligation at that point. I'm not a type of chiropractor that kind of sits somebody down and you have to have this done, you have to follow this thing, this treatment plan. I give my recommendations. If they want to take it, that's great. If they don't, that's fine too. I've also mentioned in the past that I deal with people that if they don't have the ability to pay, I work with them. I don't like to turn anybody away if they can't pay. So we can work on whatever financial, situation that they may have. Also, I gave you a pin there. Each of you got one of the pins from our office. I'd like you to write down my cell phone number. That way that if you have somebody or if you're referring somebody, they can call me on my cell phone. And then from that, I can kind of direct them which office works best for them. So if they're closer up here in Newport Beach, we can set an appointment there. Or if it's down towards Lake Forest, we can set them up down there. So my cell phone number is 949-412-9366. And definitely tell them to, if I don't answer, please leave a message. I will get back to them as soon as possible. Last thing with a pin, and this referral card is not really a great representation of me. This picture was done about a month and a half ago, so you can use the pin and draw in some hair on there also. So, yeah. So, there you go. Now, does anybody have any questions? Yes?
Is the popping noise unhealthy?
They have done studies recently that they say it is not. Although, in my opinion, is most people who do that on a consistent basis, it's a nervous habit, so they're popping their knuckles all the time, and what that can lead to is laxity in the joint. So it's just like I would not adjust somebody 4, 5, 10, 15 times a day, because the ligaments are what hold that joint together, and if they're lax, they're not going to be as stable as they should be. But the old thinking of it's going to cause arthritis, they've done studies, they've found it doesn't. But I don't suggest it. All right. Well, thank you very much. All right.